Okay, so good morning, Dr. Felician. It's
Good
very
morning,
nice
everybody.
to see you again. We've been very excited to speak to you again.
Good to hear.
After your last lecture, a lot of people had asked us questions about your study, and we have decided to call you back so you can answer the questions.
Of course. Glad to do that.
Wonderful. So I had two questions that everybody asked. One question has to do with the tests you do as part of the study and why you do them. And the other had to do with the vitamins and with all of the extra natural or non-natural medications that you recommend to patients. What do you think children with autism should take, how they should take them, etc.? So the floor is yours. Enjoy.
Thank you. Thank you for this opportunity, and I'm glad to talk to such large number of parents confronted with this big problem of ASD. To answer your questions, firstly, the test we are doing are firstly addressing the dynamics of treatment. We are trying to monitor the efficacy of the treatments, and to do that, we're trying to find a biological marker, meaning blood tests, which can objectivize the modifications taking place in the child's body. And this task is very difficult because there is a variability of the pathology in ASD kids, meaning that various causes translate into similar manifestations of this pathology. And they all have to do with the way that the brain develops and the way that we register information and we process it. And it is difficult to find universal, unique blood parameter which can give us precise indication of functioning. It's much easier to find a structural, like imagistic, a structural marker which can give us information about that. But most of ASD kids have normal magnetic resonance imaging, and very few, maybe less than 10%, 1 in 10, have modifications on EEG and things.
Doctor, you need to repeat it just a second. Repeat the last sentence. We couldn't hear you.
Sorry. So I'm saying because of the variability, the differences in the causes of this ASD, it's very difficult to find a universal marker which applies to most kids, and definitely not to all the kids. So starting with our quest in finding an objective blood test which can show that the treatment that we're giving is bad or good or indifferent, we started with various pathway indicators such as liver function tests. These are banal, these are usual stuff like AST, kidney function tests like urea and creatinine. Nothing spectacular in that. But then we move to the CBC complete blood count, where there are some differences. Maybe like 20% of kids, they have elevated eosinophils, which are related to the allergic pathways. And some of the kids also have other modification on white cells, such as lower than standard white cell count, or variation in their function which can be seen by further testing the serum proteins and the immune globulins. These are other tests that can be done, like blood serum electrophoresis, which shows the different protein fractions in the blood, like alpha-1 and alpha-2 globulins, which are related to the immune functions. And alpha-2 globulins, for example, they are increased when we have an infection. We have seen that increased in most kids with ASD. And also some kids with ASD that we tested, we didn't have many. We had treated about 45 with the stem cells so far, but we have tested much more because not all kids had become participants in the trial. They were not having the blood or anyway, we're trying to enlarge and comprise as many kids as possible, so we have a bigger pool of patients from which we can derive some conclusions or infer some theories. But going back to the tests, besides the kidney and liver function test and the complete blood count, which gives us first image of the white cells and the immune system, then we go to the more functional testing, such as serum electrophoresis, which gives us the various components like alpha-1, alpha-2 globulins and the gamma globulins, which are the antibodies. And besides that, we have done the IgE testing in particular kids which showed increased eosinophilia, or they had a clear clinical history of allergies that the patients were aware of. So moving to the immune function, we also test for inflammation markers, which are known to be increased in many kids, maybe about 70 or 80% of the kids, judging from all the data published. And for that, we're doing tumor necrosis factor alpha, which is acute phase reactant. And this was increased in around 80% of kids, not to a very high extent. The high normal limit is about 8.1 nanograms, and we're seeing 8.6, 9 something. Very rarely we see above 10. So these are small increases in the activity of the white cells, but they seem to be big enough to create suboptimal environment for the neurons to function. Because one of the things which we know is the microglia, which is the white cell equivalent existing in the brain. They have also increased activity on the inflammation type direction. And this can be very clearly and objectively measured with the GFAP, glial fibrillary acidic protein. And one of the things that happen when microglia is activated is that the NF-kappa beta is elevated. And this is a very important molecule in the cytoplasm, the nucleus of most cells, including neurons, because it is one of the first molecules to be activated in inflammation, but it is also, this NF-kappa beta is involved in making synapses, meaning the links between neurons on which we are basing our memorizing and activity of the brain. So increasing the NF-kappa beta as an answer to inflammatory actions, the inflammatory environment, also increases the synapses which are formed. However, this is not a functional consequence. which happens when we memorize things. It is a chaotic activity. So the synapses are increased, and this was evidenced on anatomopathological studies and on functional MRIs. So there are more synapses in about 60% of the kids with ASD, but they're not functional. They are noise, background noise, which makes things more difficult to work for the kid. It's much more difficult for the kid to select the stimuli which is relevant to forming new connections, new ideas, new notions on which is based the memorizing, learning, and understanding the environment.
Do you think that this particular part of your testing can identify ahead of time if this child will grow to be autistic or not? We came across this neuron-specific enolase, which is an enzyme which is increased in the blood when neuronal destruction happens. And we have seen it increased in essentially all kids with ASD. So this NSE, neuron-specific enolase, is increased, and this is an objective finding. However, it is not very specific to ASD kids, and we're trying to couple this with GFAP or another inflammatory marker in order to more specifically differentiate the ASD kids from kids with no such problem. And on one hand, elevated NSE gives us easy, accessible. It is not very expensive either. It's about, I don't know, 15 euros here in Romania. And I guess it's not much more elsewhere. So it's a blood test which can give us an indication about the extent of the neural destruction in ASD, but this doesn't happen only in ASD. And trying to be more specific, we need to add another marker for that, like GFAP. Doing this in a 1-year-old kid may pinpoint the diagnosis of ASD much earlier than waiting for another developmental landmarks to be absent. Besides lack of eye contact and stereotypical movements and so on and so forth, we may have a biological marker which can help us detect a potential problem much earlier in the child's life. And it is pretty clear that early intervention is beneficial for ASD kids. Whenever... I have a question for you.
Yeah.
Based on what you are saying, if I have a child at home and he's autistic, and I also have a 1-year-old child, and I don't know what he is like, if I will perform these tests and they will come positive or with a result that matches developmental of autism, is it possible, in your opinion, in the future, not right now, based on this kind of study, to do an early intervention before the child even regresses with cord blood?
Yes, I think it's getting there. We always need confirmation from a higher number of patients. And fortunately, after Dr. Werther published this potential NSE marker, we had inquiry coming from US about testing a big number of ASD samples. And I think that NSE body itself is a big warning sign. But to be more specific, we need to do another biomarker like GFAP, which indicates specific inflammation in the brain, specific microglia increased activity, inflammation-like activity. So these two markers can definitely pinpoint a diagnosis with probably like 90% accuracy, meaning sensitivity and specificity. And there are many aspects to this ASD diagnosis. You say that we can intervene before the kid is showing signs of regress or to a better point in the developmental status of the kid. And one of the things that I've seen, maybe in like 15% of the kids, is immune system imbalance, which affects the functioning of the brain. Some parents said, okay, he was doing okay until he got a very severe infection for which he needed the hospital admission. Or he was doing okay until we got him the 6 vaccines in a very short time. And then he showed very, very soon afterwards, he showed deterioration. So maybe if we see in a kid some signs of unusual development, maybe we can test this NSC-GFAP combination and see if there is a higher chance of being vulnerable or having an immune system which reacts improperly to infection or vaccine. And maybe
this is really important, because one of the claims for vaccination, which we have discussed this in the past, and I told you that I vaccine my children. One of the claims that vaccinations causes autism. Now, the question is, in your opinion, if the problem is the vaccine or the problem that this child was already autistic and the vaccine made it worse?
I'm sure that there is a problem with the immune system of that kid. And the problem is already there. The immune system has a specific vulnerability. And not only some vaccination, but some severe infection. And I've seen kids with this history. This can put the problem on the spot. So the kid can develop, let's say, very close to normal, although he has this immune problem. And then when the immune system becomes hyperactive because of a severe infection or getting the hexavalent, a lot of vaccine in a very short time and making the immune system overactive, this can trigger the full-blown problem on the immune system and the nervous system. But this is not the majority of kids. This is the scenario for maybe 20% of the kids with ASD.
Okay, but this part has to be clear because your lecture is going on our website. I just want to ask again to make it clear, and then I will also translate it to Hebrew. So accordingly, what you are saying, if I understood correctly, for these amount of children, not all of the autistic children, but some of them.
A minority.
The minority, they already have an immune system problem.
Yes.
When they get very ill, or if they will get a big amount of vaccinations in one go, not vaccinations entirely. So if I will give the vaccination slowly, there will not be a problem. But if I will say 5 or 6 vaccinations at the same time, then the situation, their autistic syndrome will get worse.
It is very, very likely that that will happen.
Okay, and so now I will translate it to Hebrew because this point has to be made very clear.
And vaccines should not be avoided.
Thank you. Because this is important. This is one of the biggest issues surrounding autism. So I will translate it now to Hebrew. Thank you. מה שהוא מנסה להסביר זה שבחלק קטן מהמקרים של אוטיזם יש בעיה אוטואימיונית כבר מדרך התחילה, ואז כשהילד מקבל איזושהי מחלה זיהומית קשה, מחלה עם חום וכן הלאה, או שאנחנו נותנים הרבה מאוד חיסונים באותו פעם, לא חיסונים באופן כללי, אלא נגיד את המחומשת באותו יום, את ה-MMR באותו יום, זאת אומרת מקבץ גדול של חיסונים באותו פעם, אז אנחנו יכולים להחמיר את הסיטואציה שהייתה קורית בכל מקרה. בכל מקרה היה הופך להיות אוטיסט, אבל אנחנו יכולים להחמיר את זה. זה מה שהוא אומר. זה לא אומר שצריך להימנע מחיסונים, אבל יכול להיות בילדים כאלה שרצוי לחסן לאט לאט, ולא במנה אחת את כל החיסונים כמו שלפעמים עושים. Okay, doctor, continue.
So to make a short resume, a short abstract of this, inflammation is present in a majority of ASD kids, but vaccination by itself is not the cause of ASD, and vaccine should be given to kids, but with no concentration. I mean, you spatiate them. You don't give them all at once in 1 week or very close, because then you overwhelm the immune system. And
yes, because here it's traditional to do MMRV together with other vaccinations on the same day.
And this works for 90% of the kids or more. It's okay for most of the kids, but unfortunately, well, we know the ASD prevalence is about 1 in 50 kids. So it's maybe, so it's less than 1%. So we cannot make a campaign saying that vaccines are bad or the cause of ASD, because that is not true. Giving vaccines very close and very close to each other can trigger this, but the cause is not the vaccine. The cause is an imbalanced immune system, a vulnerable immune system. And sooner or later, this kind of problems will happen in the kid's life. Is of course not good that it's happening to 1 year or 2 years, but so far we don't have a specific test to say this kid is vulnerable to vaccines or to vaccinations in a close sequence or to severe infection. We're trying to see what kind of HLA type of genes are associated with this kind of response. But we've seen differences in populations in Romania compared to the kids that we had from overseas, well, from other countries. So it's clear that it's not a specific gene in the immune system which triggers this, but interaction and arrangement. So it's a complex problem, and it's impossible to solve it by one team in one medical center. And it's important to get the information out and try to collaborate on it. Sorry, you say something. I can't hear you. You have the.
It's fine. She just hooked in and she didn't put on mute in time.
So I don't want to get this misunderstood or misinterpreted. Vaccination can trigger the ASD symptoms in a vulnerable child, but it is in a minority of ASD kids, maybe like 10% or 20% at most of the ASD kids. And it should not be avoided, just scheduled differently for kids who have a family history of problems like this. They should be treated differently, not like the general population. So there's nothing against vaccines. It's just something that needs to be better administered.
Okay. I would really like it if you can explain maybe what kind of tests you want your patients to do and when you want them to do them.
Yes. Coming back to the original idea, we were giving 3 sets of tests because we have one comparator being the supplements, and we're trying to do a set of tests, blood tests, before and after each of these steps. But to make it easier for patients from overseas, we're limiting blood testing to 2 sets, before and after the administration of the core blood. And this initial set, or the initial set of blood tests, can be done either in Israel or in Bucharest, depending on the travel arrangements of the family. And if it is done in Bucharest, we can do it either a couple of days before administering, or in the morning of the administration, just before the administration. And this is less traumatizing for the kid, because kids, of course, they don't like sticks, needle sticks, and blood drones, and hospitals. And so the idea is to do a set of blood tests before administering the core blood, and after 4 or 6 or maybe even 8 weeks afterwards. And there is no rigid time after the administration, because many kids develop colds, respiratory infections, flu or colds. And in these periods, when the kid is having a cold, all the inflammatory markers are up, because the immune system reacts to it, and that will get us off track, because we have seen subacute inflammation in kids with ASD who do not have a current cold. But if you test a kid when he's having a cold, of course, the inflammatory markers will be increased. And this will give us a false idea about what's going on, a lack of efficacy. Or so it is important to have these blood tests when the kid is not ill, is not coming with a common cold or a flu, or a gastrointestinal infection that also triggers an immune reaction from the kid.
Okay.
So we're having one set of blood tests before, and that can be done in Bucharest. Maybe it's easier for the parents to do it in Israel first. And this set of blood tests necessarily include the NSE, the neuron-specific enolase, which documents the destruction of the neurons, and also inflammatory markers such as tumor necrosis factor alpha, or the CRP, of course, which is less frequently increased than TNF. And besides this, we're also testing for some metabolic pathways, such as homocysteine. Homocysteine, which is related to the folate metabolism. And we know that in some kids, it's difficult to tell an exact percentage, maybe 10% or maybe 20%. The folate metabolism is affected, and this affects the methylation pathways and the activity of genes. Of course, this affects development of neurons, migration of neurons. So homocysteine increased or decreased can be very well addressed with some supplements. And we're getting to this topic of today's talk, because the core blood is mostly modulating the immune system. for homocysteine, we need to give antioxidants. I have seen that antioxidants positively affect many kids before and after administration of cord blood, because even though the pathology is very different in many kids, commonly there is a problem in neuron function, whether it is caused by immune system or by intrinsic genetic problem with the neurons. There is a problem with the mitochondrial activity, which generates more free radicals. The oxidative status is effective, and generally speaking, antioxidant work very well in many kids, and you cannot go wrong with that. We can go to the molecular level and test for specific genes, and we have seen kids who have deficiency in the function of specific genes related to neurotransmitters and to liver detox phases 1 and 2. And all this is well influenced for the better in administration of supplements, antioxidants, like reduced glutathione. Glutathione, given by itself, is modified in the digestive system, so we need to get reduced glutathione because it is better absorbed. And besides this, there's the N-acetylcysteine, also S-adenosylmethionine, and here we need to make some parentheses, because the genes involved in the neurotransmitter pathways can be part of the synthesis of these neurotransmitters. So if they're affected, the neurotransmitters are low levels, and we need to increase that, or can be also involved the genes or affected the genes which are degrading these neurotransmitters. So the level of these neurotransmitters are high. So it can happen in both ways, low and high neurotransmitters. And we have also inhibitory and excitatory neurotransmitters. And we need to know which ones are elevated. Some kids react very well to gamma-aminobutyric acid, GABA-like substances, and there are syrups for kids that can be given, and some kids become less agitated with that. But some kids, when you give them this GABA, become very agitated. So this is because...
I just want to explain to the parents for a minute. When
Sure.
you decide to give some supplement for a child, how do you decide to give this particular supplement to this particular child? Or do you have like this panel of supplements we can say all autistic children should receive?
We can go, so there's, let's say, 20 supplements which are available to kids. And to individualize the supplements, we're doing this testing, the blood tests, which can give us the first information about inflammation, the extent of neuronal degradation, and if there is any gross metabolic dysfunction, like homocysteine or ferritin. And based on this, we give some kind of supplements. So this is one direction of information. The other is the behavioral assessment, and of course the psychotherapeutic evaluation. And if the child shows agitation, moderate or severe, then we necessarily give the child something on that direction. And traditionally, there is medication such as aripiprazole, antipsychotic, or risperidone for very agitated kids. And risperidone has a problem of increasing the prolactin levels. And I'm not very happy to see kids on that. And at least we change it to aripiprazole. But this is in very agitated kids who do not respond to the parents' request to cool down and try to be attentive. So in order to decrease agitation, we're going for natural extracts such as passiflora. I'm giving the Latin names, but you'll find it in that.
Passiflora is the same in Hebrew. Passion fruit, it's the same in Hebrew, passiflora.
And valerian and tilia and humulus. And I have seen this working very well for many kids with agitation. At the same time, I have seen one of the 40 kids who did not respond and even become more agitated with this, or to GABA, gamma-aminobutyric acid. So it's not a very precise thing, because the next level and the next set of information based on which we can adjust the supplements is the genetic, the molecular level. And there we see the specific pathways of neurotransmitters synthesis and degradation. And on both sides, they can be affected. So if you have a inhibitory neurotransmitters such as GABA, which is not synthesized in enough quantities, you'll have a kid who will be very agitated and maybe at some point will develop convulsions in the extreme situations like GABBR2. In other situations.
I want to ask, because I think that it needs to be very clear to parents. I have a lot of parents who call me and they ask if they can do the blood panel that you do in your research. If they can do the blood panel here in Israel, or send blood from Israel to you. And accordingly of their blood test, you can recommend what to give the child. And if you believe that these supplements will be enough to not having to do cord blood.
Well, if there is, I'll go straight for the answer. If there is immune dysfunction, then which is subacute inflammation, TNF alpha, CRP, interleukin 1 beta or 6, then probably the cord blood will work better, and the supplements by themselves will not be enough. If there is primarily NSC destruction, but very low inflammation or absent inflammation detectable by this test, then supplements will probably be very efficient and probably will not get a big benefit from cord blood. And so if inflammation is very...
I need you to say it slowly, and I will translate everything that you are saying, because I think that from everything we discussed, this is the main point of the lecture today.
Sure.
So let's discuss about the first kind of children. I will translate it, and then we'll discuss the second kind of children.
Let me tell it shortly. If inflammation is present on more than one marker, let's say TNF alpha, CRP, alpha-2 globulins, maybe interleukin, then immune modulation by cord blood is better, and it is a good idea.
Okay, I will translate it now. Just a second, I cannot remember that much information. מה שהוא מנסה, אנחנו מדברים עכשיו על איזה ילדים אנחנו צריכים לתת להם דם טבורי, ואיזה ילדים יכול להיות שאין חובה לתת דם טבורי, ואפשר לטפל גם בעזרת תוספי תזונה. מה שהוא אומר, שאם לפי בדיקות הדם של הילד, יש נוכחות לדלקתיות יתר, הוא מפרט איזה סוגים של בדיקות צריך לעשות כדי להגיד שכאן יש עניין של דלקתיות יתר, שם ככל הנראה דם טבורי בוודאות יעבוד, וכדאי מאוד לתת דם טבורי. Continue, doctor.
If the NSC, the neuron-specific enolase, is normal, and I have seen this in just one kid out of 50-something, then I do not recommend the cord blood because it's clearly a genetic problem. And unless we test the cord blood itself for that problem, and we see that the cord blood is not having this genetic problem, then there is no logic to give the cord blood.
You're speaking about self-donated. So if we give foreign donation, it's a different story.
Foreign donation is definitely well, but
okay. I will explain it now. מה שהוא אומר, הוא מדבר על דם טבורי עצמי, שהוא רק בילד אחד מתוך 50 ילדים שהוא בדק. הוא ראה שאחד המרקרים NSE, שעליו הוא מדבר באופן ספציפי, היה תקין, ואז כדי לתת את הדם הטבורי העצמי צריך לבדוק האם גם בדם הטבורי אין איזושהי לקות, כי הוא אומר שלדעתו במקרה הספציפי הזה שהמרקרים הדלקתיים הם תקינים, הבעיה של האוטיזם היא גנטית, ולכן דם טבורי עצמי בלבד לא יעזור. דם טבורי מתורם דווקא כן יכול להיות שיעזור. Okay, I'm done.
So we have basically like three main scenarios. If NSE is normal, then definitely not own blood, no autologous cord blood. This is the first scenario, but this is very rare. I only had it in 1 in 50 kids. The second scenario is high NSE, but normal immune system. There's no inflammation. Then it's questionable to give cord blood. And the most common situation, and which we treated well, is both NSE and the immune system dysfunction, inflammation is present. And then we had a very good reason to give even own cord blood, even if it's a genetic problem in the kid, because the cord blood, besides the stem cells, it contains also some factors which are growth factors for the neurons. And also there is the thing of mosaicism, which means chimeric, which means that the mutation is not present in all cells, especially in the naive, immature cells from birth. Because
so what you are saying is that there could be a genetic problem, but it will not appear in the cord blood?
There certainly are some genes which are not expressed both in somatic and in stem cells. And I've seen recently H2 gene, which is not detectable in PMNs, in polymorphonuclears in cord blood. So this is not a supposition, is a fact. There are differences in the DNA between the stem cells and the somatic cells. And also the white cells, the immune system cells, responding to infections, to outside microbial agents, they rearrange their DNA, the T cells and the B cells, to make the antibodies and to recognize that specific antigen efficiently annihilated. So we can say that there is a difference between administering naive cord blood, which was not modified by contact with various antigens, microbes, pathogens, or even by vaccination, and giving the stem cells from a kid at 2, 3, 5, 7 years by bone marrow aspiration, which is done in Vienna, for example, because these cells are modified by environmental agents.
Is there a point to give bone marrow? Is it better than giving cells from placenta and umbilical cord? or because bone marrow aspiration is a medical procedure, a very serious medical procedure. We see clinics giving treatment from placenta, umbilical cord, or from donated cord blood. Is there a preference to bone marrow, or is it the same?
It is questionable. Firstly, I have to say that I haven't seen the published data from Vienna, from Professor Kobinia. And I spoke with Professor Gesundheit, and he said that there's little chance of the results being published. He definitely has hundreds of kids with ASD who were treated with bone marrow aspiration and subsequent administration. But we really don't know the percentage efficacy of that. And it's difficult to compare it. But if I were to guess, I think cord blood, own cord blood, autologous cord blood, I think it's preferable to bone marrow aspiration because of lack of modifications induced by environment and pathogens. Immature white cells from cord blood are better than stromal cells from bone marrow, which are definitely influenced by what they come in contact with. And this is one way of viewing things. The other thing is the easiness of doing things. It's easier and safer to do cord blood administration than bone marrow aspiration and infusion. So I have to say that it's difficult to compare the results since we have no data on the bone marrow aspiration efficacy. But I think cord blood has a good use when it is being administered to ASD kids.
So if I have because for my patients here in Israel, they can purchase a cord blood unit from abroad and have it done there, like in Netherlands, or receive cord blood or placenta-derived MSC. They can do it in Belgrade, they can do it in Slovakia, they can do it in many countries.
Yes.
Okay, but bone marrow, when I received a few children for further treatment that had done bone marrow, and I have to say, I didn't see very good results. But the one thing I did see with all of these children is that they did go through a medical procedure. For some of these children, it was very difficult to do. So when I send a child abroad to do treatment, because most of the treatments I can't do here in Israel, part of my consideration is how difficult will be the process. So for cord blood, it's very simple. It takes a few minutes. It's fairly safe. And I'm very relaxed sending these children, especially to clinics that does research programs like yours, where I know the doctors are very gentle with the child, very knowledgeable. But when I send a child for cord blood, for bone marrow, I know in advance that this child is going to go through a medical experience which is more complicated. And I'm wondering if it's worth it. I have an option to give something else. It will cost the child probably around the same amount of money. Is there a point at this point of history to give children bone marrow for autism, not for all diseases, just autism?
Yes, it may seem self-serving for me to say give cord blood instead of bone marrow aspirate, because I'm doing cord blood and I'm not doing the bone marrow. But I really think that's an advantage to it. And the other thing is the dose of pseudoanalgesia needed for aspiration of bone marrow. The incidence of throwing up, and there are minor adverse reactions, but there are. And I think we don't have an invasive procedure with the everyone risk. I haven't heard about any bone marrow complication, bone marrow aspiration or complication, but I'll definitely say first right.
There are no complications. First of all, we all know if you do bone marrow aspiration in a small amount of cases, there are some local infections. It's something known. It's registered in medical history. But you know, we do bone marrow aspiration all the time for cancer. But here, there is no other choice. For cancer, I have nothing else. For autism, I have. For autism, I have the option of doing cord blood, donated or non-donated. I have other options, and I'm truly wondering if in this point of history, we should refer children to such intense medical intervention that we have other solutions for. I'm always, for my children, my private children, I will always look for the easiest medical solution, the one that is fast, that is easy, that has no complications.
It's safer, yes.
Safer, and also that's less traumatic.
Yes.
I think the trauma part of stem cells is not being discussed. We are not talking about how difficult it is for a child to go to a foreign country or even to his own country and have somebody stick him with a needle, have somebody put him under anesthesia. It's very scary for a child. So when I look at a protocol for a clinic, part of what I'm looking is how painful is it going to be? How long is it going to be? And it's definitely part of my consideration as a parent, but also as a caretaker of what kind of procedure to do. I do want to ask you a question. It was asked to me, so I'm asking you.
Sure.
Here in Israel, we vaccinate children when they are born. The day of birth, we give them 2 injections. One is vitamin K. Of course, it's not a vaccine. It's only to allow the child to clot properly. And the other is hepatitis B. This is the other injection that we give all newborn children on date of birth. And as a nursery nurse 10 years ago, and even today, I'm being asked by parents, is it safe to give this kind of vaccine to a child the day of birth?
Well, the best answer can be given only if we have access to data. But developing an idea that we said earlier, I think it is safe. It is unsafe, or it's not even about safety. It's about the probability of a particular child who is vulnerable, who has an immune system which can give trouble later. Is it exposing the child to a bigger risk? And I think just one vaccine is okay, even for ASD kid. When you combine, you know, in consecutive days or in the same day, or maybe even in 1 week, when you combine 6 pathogens, you have a good chance to confuse the immune system or to overwhelm the immune system. So I think to put distance between vaccines, it's good enough. And I don't think giving Hep B in day 1 is a problem. It's a problem if you give more than 1 in the first in a few days. Then you have a chance.
How about maybe the most slandered vaccine, MMRV? We give it at 1 year old or 1.5 year old. We give MMRV, and Prevenal, usually we give it on the same time. But let's say we separate the MMRV, which is the vaccine that people believe causes autism.
Well, in the best case scenario, we can involve the manufacturer in studying the incidence of the problems occurring after the vaccinations. There are doctors who know, I'm not a pediatrician, but who have seen many kids, and they know kids who develop problems after the vaccinations. And working with the vaccine manufacturer may address this issue, because if we give no more than, let's say, 2 pathogens once, you know, there should be probably an option to give these pathogens separately.
Yes, there is. I can do MMRV. I can separate the 2 different vaccines. Even here in Israel, we can do the varicella on one day, and 2 or 3 weeks after, we can do the MMR. This is something that is possible, no problem. But MMR is still 3 different pathogens in one injection, and it's not separatable.
Well, it's difficult for me to say something very clear-cut, but I think it can be developed an option, especially if you have a family history of ASD-like issues, you know, then you should have the option of giving something else, and something else meaning separating the 3. And you don't deprive the kid from having the vaccine, and at the same time you avoid the problem. The problem is still there, but you don't trigger it.
I see. So this particular child, he will be autistic in the end. So if he will be autistic at 4, at 5, at 10 years old, it will happen at some point, but it will be triggered also by the vaccine. So the vaccine doesn't change, if I understand correctly, it doesn't change the fact that this child has this problem, but it can aggravate it and make it come out faster.
Yes, it's also an issue of the time in development where we give this vaccine, because if we give it early at 1 year, we eliminate some risks, but at the same time, if we trigger in 10% of kids this ASD-like symptoms, then it's not good either. So if you give the same MMR at 3 years old or 6 years old, that kid has a chance to develop some knowledge and some skills better. And
so it's mainly about the timing. If I will vaccinate later, then there is an advantage to vaccinate these children later in life.
Shira, it is just...
I'm making it really difficult for you. I'm sorry. If it's something that you cannot answer, it's okay to say I can't answer.
I don't know the answer to that. I'm just exposing some ideas, and maybe you know, the vaccine manufacturers and the pediatrician and the parents can work with it. I cannot make a recommendation for one thing or another, but for sure, hepatitis B in day 1 is not a problem. Okay. It's a problem when you overstimulate the immune system.
Okay, so last vaccination question. This one is relevant to you because you may have a recommendation. I was recommended by a few different doctors to not vaccinate the month before giving cord blood and the 3 months after giving cord blood. Some of them had made this recommendation because of what we do with immunoglobulin treatment, that we don't recommend around the time we give them. Is there any limitation on vaccination around giving cord blood? Like, should you not vaccinate a few days before, X days after?
Well, depends on the type of vaccine. If you give attenuated live vaccine, the chance of having an adverse reaction increases. And then we can postpone that for after giving the cord blood.
How long after?
I think at least 1 month. 3 months is probably optimal, but at least 1 month after the cord blood.
And before cord blood?
Before cord blood really doesn't make a difference, because we're gonna modulate the immune system afterwards, especially if it's a simple vaccine. It's not a combined three pathogens vaccine. I don't think it's a problem. But again, these are not facts. These are just suppositions.
Okay.
Yes.
No, it's important because, for example, I had patients coming during the winter when we vaccine for flu.
Yes.
Regularly. And for autistic kids who tend to be very ill, we do vaccinate them for flu. And as we said before, if you give a single vaccine, it's okay, no problem. But I also want to send them for cord blood. So if I know that it's okay to vaccine them beforehand, no problem. But after, not to vaccine for 2 or 3 months, I can help the parents schedule it better. So this is very...
One way to do it is do the vaccination and give them some anti-inflammatory, like ibuprofen, if they develop flu-like symptoms.
Okay.
Or fever. There's a question that Mr. Nurit Manukovsky asked a little earlier, in case of abnormal NSC, but no indication of increased inflammation, what is the suggested treatment? And the suggested treatment is supplements. And I'm not sure if I mentioned it, but in one kid of the 40-something that we treated, the supplements gave better results than the cord blood administration. So especially antioxidants, you can give them to all kids with no problem. You can give them before cord blood, after cord blood, or with no cord blood. As I say, immune system dysfunction is the main issue addressed by cord blood. And if there is no inflammation, then the biggest benefit of the cord blood is those growth factor, this nutritious factor contained in exosomes, which are improving the activity of the neurons. Because besides the stem cells themselves, they also secrete some substances which improve the functioning of both the immune cells and also the neurons. So in case of abnormal NSC, but no increased inflammation, the first option will be the supplements, but you can have benefits also from cord blood. It's not clear cut, is no contraindication, and I'll always recommend antioxidants before and after, and in some cases as the only treatment. I'm not recommending against cord blood. It's just that it's an expense.
Supplementary treatment.
Yes, the supplements, the antioxidants can give improvement to the functioning of the neurons via mitochondria. And the antioxidants...
Doctor, I can see that there's a question here from the crowd. מי שרצה לשאול, זה זמן טוב לשאול. פשוט תפתחו את המיקרופונים ותשאלו. Somebody raised their hand and they're not asking anything.
Yes, hi. I have a question, please. I'm in UK, so what antioxidants, any particular names that you may have of antioxidants?
The reduced glutathione, you can have, definitely you have a plethora of antioxidants from UK and from US. There is the iHerb site. There's also Amazon.co.uk. You can find reduced glutathione. It's one of them. I know it works very well for a lot of kids. There's also NAC, N-acetylcysteine. There's the S-adenosylmethionine, SAM. But this also raises some issues, because if you have genes affected in the degradation of catecholamine transmitters, then SAM is not a good idea. So you have to be more specific. So glutathione reduced is an excellent idea, and it's pretty universal. And other than this, we have to be more specific based on the testing, on the genetic testing in this case. And there is a company in the US, Ancestry DNA, which makes it from saliva. They send you a kit, they test it, they do the sequencing, and then it's a pretty good price. It's about $100, something like that. And then you can have this sequencing of the genome and then upload it on different sites and have the information about how different genes work, including this involved in liver detox and catecholamine synthesis, and so on and so forth. So going back to your question, in UK, you can find plenty of antioxidant products. What I have seen, vitamin C, for example, ascorbic acid, is a very good antioxidant. However, it also increases the activity of white cells in some kids. And in some kids, gives agitation, because increased white cells activity, is related to inflammation, and it has deleterious effect on neuronal activity. So rather than products with vitamin C, first go to reduced glutathione. And also from US, I think is Gero's formula. It's an antioxidant optimizer, which is a good combination of cellular antioxidants, which are working, I've seen, give best results in patients with high ferritin levels, who was also having a hemoglobinopathy, thalassemia minor, for which he has a microcytosis and increased number of red cells. I hope I answered your question.
Yeah, can you repeat? Is it called as Ancestry DNA in US, the website?
I'll send the email.
You can send me the information by email, and I will attach it to this lecture, as well as the different, if you can write down from the websites, you know, what kind of supplements you recommend for all patients to take before and after, and also the spray that you recommend.
Yes.
An important question.
Thank you. Yes, it's very important. When traveling, before around 1 week before the administration of cells and 2 weeks after, it is important to protect the nasopharynx for respiratory infections from the pathogens which we can get from air particles, and they colonize the nose.
Sick children in our preschool, basically.
Yes, and it's much better than wearing a mask, because the mask protects others, not the wearer, the one who wears the mask. It protects the others from the particles. So if you want to protect your own, use this spray in the throat, definitely. And there are some products which you can use in the nostrils. Not all kids accept, being sprayed in the nostrils, but that's the best protection you can offer, because the IgAs are secreted 2 weeks after coming in contact with the pathogen. So we need something locally which can counteract the virus which we get from others. So very important, it's a nasopharynx spray, and some kids accept spray with propolis, but some kids are allergic to it. And there are some other substances. I think I sent you, Shira, some examples. So definitely use that. It's a must. It's a very high recommendation to use the nasopharynx protection before and 2 weeks after the cells.
Yes, and we will attach what you sent us also to the lecture when it's being advertised. Anybody has other questions before we let the very nice doctor go about his day?
I have a question. I wanted to ask, what dosage of reduced glutathione do you recommend? My son is 8, if it matters.
Yes, the body weight is important. We do not have a standardized dose recommendation. It's okay to start with about 300 milligrams, meaning 1 capsule a day. And we watch for the modification in behavior and how well it tolerates, and we can increase to 2 capsules a day to 8 years old.
And how long is it expected to take for any improvement to appear?
We should see improvement in at most 7 days, in at most 1 week. So we can see improvements after 2 or 3 days. And if we don't see improvements after 1 week, it's very likely that another pathway is involved in the problems of the kid. So we can practically get 1 vial of antioxidant, administer it, and if there's no benefit, then means that we have to go another way.
And then if the glutathione does not help me, what should I try next?
we should do the blood test and maybe even better the genetic testing, the sequencing from buccals, from swab, from mouth, or from saliva. It's the least invasive. Yeah, it's this ancestry DNA, as I said, is sending you the kit. You have to register. They send you the kit. I think it's like
we have a problem with ancestry DNA because in Israel we have a law that protects children. Yes, it protects children genetics.
I understand.
I have a problem with this kind of testing. I have tried. What you can do is order it through a different country and have somebody from that country send it to you. But I have a question, and I think a lot of the people that will be watching this lecture will ask if we can get organized as a group and send you blood for these children. And if you could, even for a form of payment, and then if you can recommend subsidy, you know, anything for these children, any kind of medication for these children. You don't have to answer it now. You can think about it.
I can give an answer right now from what I say, what I know. Most of the blood tests from that panel can be done in Israel, definitely. The NSC, from my understanding, is not currently done, and it's a problem. And I'm not sure if it's worth making a trip to Bucharest just for NSC and TNF alpha. NSC, as I said, is about 15 euros, 1.5. And TNF alpha is more expensive. It's more like 40 euros, 40. But making a special trip just for the blood test, not sure if it's worth. Sending the blood vials to Bucharest, I haven't asked the lab if we can do that, because I'll definitely have to ask first if we can test that. I think it's feasible, but again, it's worth only if you do maybe 2, 3, 4 kids at once, because
yes, obviously, only in a group, only group testing.
But let me ask the lab first if they test the blood without the person being there. Yes, so I have to ask that first.
That's wonderful. Anybody else wants to ask a question before we let the good doctor do what he needs to do? No, I feel for you. I'm sending you patients this week and next week, so I know you need to take care of them.
Yeah, the good doctor objective is making me smile. Anyway.
Anybody else wants a question? Have a look. Okay.
They can email you also, and I'll address them as they come. So I'll definitely have to ask the lab about testing the blood, but from what I understand, just NSC is a problem testing in Israel.
NSC, we found a lab in Rambam Hospital that will do this for a significant amount of pay, but they will.
So there's no point in coming to Bucharest just for this, you know?
No, there isn't. They do want a recommendation letter from you.
Sure, that's not a problem.
Pediatrician will register this test. So I want to thank you very much for your time. I have to say that not many doctors are able to give such a clear lecture. And whenever I ask anything from you, you're always there, even in the middle of the night. So I appreciate your work very much.
Me too. Yes, I just hope that kids will really get help and make a difference in their life, because it's a really, really tough fight for the parents. And sometimes it's affecting me seeing these kids fight, and this is the least I can do. It's not just you know, empty words. I really hope that this may get somewhere, you know.
And we are very much happy to work with you. I think that what you do is not something that is being done everywhere. So I really appreciate the time you take for the patients. It's not something that's clear to everybody that will happen. So thank you very much. And we will stop the recording now. If anybody would want to ask a second question without it being recorded, you can. And if not, we're going to let you go do what you need to do since you have Israeli patients coming.
Yeah, there's a korban coming today. Thank you, Shira, for organizing this and for moderating in a very nice way this meeting. And as much as I find out new things, I'll keep you informed, and hopefully this will make a difference in some kids' life.
We hope so too. Thank you.